Signs of tongue ties on a newborn. Common red flags if you're breastfeeding is painful latch, inability to latch, milk leaking or clicking, the baby sliding off, and not getting like a full feed from the breast. So when you breastfeed, there's something called a letdown, which is when milk just naturally flows out of the breast. And then after that, the baby has to actively use their tongue to get the rest of the milk out. Well, babies that have compromised tongue mobility are unable to do that. So they do the letdown and then they just stop feeding, but usually they're not full. So then they want to feed again frequently afterwards. If they are bottle feeding, there are also signs that you can look for on tongue ties. Clicking noises, leakage of the milk, also just looking like they can't get a latch and into a rhythm on the bottle. They almost look like they don't know what to do with the nipple. Feeding and latching should be very natural to babies. So they shouldn't really look like they don't know what they're doing. If it's that case, then they're usually struggling with mobility. Poor weight gain is another one that we see. And then if you hear that clicking sound, likely the baby is also taking in extra air while feeding. So then they can be gassier and spit up more and present as a more sort of colicky baby. So those are the things we see on infants. It can be a little bit tricky because, again, there are ways to compensate for these signs. So if a mom has a really great milk supply, then baby doesn't have to work very hard to get the milk out. Or we now have a million shapes of bottle nipples to help a baby latch correctly. So in my opinion, it's important just to get a screening on every baby we can see, because sometimes these signs are not as obvious. But if you see any of these major red flags, I would definitely recommend seeking out a consultation with a provider that does a comprehensive consultation of your baby.